In the Newsroom is a production in partnership with Studio Stillwater. Every week, journalists from the Stillwater News Press invite listeners to join us in the newsroom and hear the story behind the stories. Hello and welcome to In the Newsroom. I'm Beau Simmons, editor of the Stillwater News Press. With me today, city editor Michelle Charles.
Hello.
Reporter Ashlynd Huffman.
Hello.
And it's been a little while.
It has.
I think it's been long enough that we can say since we were last on, it's like we're now back in a full-blown pandemic.
It feels that way, yes.
Our coverage. It's led our coverage at least for the last couple days.
Yeah.
Last week or so.
It kind of felt like we were on our way out of it. And no, we took a turn.
Back to more pandemic chat.
Yeah.
But this is not going to be a soothing fireside chat.
Not really.
We don't have those kind of answers.
I don't think anyone really has the answers at this point. I think that's what we've learned this week, right?
Yeah. But you did something pretty interesting that I haven't seen a ton of folks do, even for, I guess, in Oklahoma media. You talked specifically to some college instructors.
Yes.
And they have been on the very nervous side of reintroducing things. So what were some things you learned?
They're struggling.
Yeah.
I mean, because they feel like they're limited in what they can do, first of all. They've been in a position where they just had to sort of ask very nicely. You know, in addition to the people I interviewed for the story, there are other professors that I am Facebook friends with who, they've been sharing stories on Facebook of what they're going through. And there's one particular one who has a son who's young enough that he can't be vaccinated, which is the case with many of them, actually, many of the younger faculty members. And basically, they hand out masks and they say, I'd really appreciate it if everyone would wear a mask. We're all in this together. They do the all in this together speech. And then the students sit there and just kind of look at them and they don't put the masks on. And anyway, this one particular woman, she actually, had the standard PowerPoint thing that you do to introduce, you do the overheads.
Okay.
And she included a picture of her adorable young son in that PowerPoint and said, this is my son who can't be vaccinated.
This is his life is on all of you now. That's sort of like she's pointing to this.
Exactly.
Now it's your response, not just my responsibility. Now it's your responsibility.
Exactly. The decision you make today impacts this child. She made it personal, and I don't know that it's still reached everyone. Is the whole point. She made the comment that there is one student who flat out has refused to put a mask on, and he sits on the front row, and she feels smirks at her through the entire class. So that's like, just out and out kind of aggressive. But the others are getting, a little bit more cooperation. It just it seems to depend a little bit on the size of the class, I think, kind of how personal it feels. The people that I've seen who teach smaller classes, or the students that I talk to who are in smaller classes, seem to feel more of an obligation to help out. Maybe they feel more of a sense of connection with their professor because there's just 15, 18 of them in a room and they're not that far away. Whereas if you're the professor I talked to who teaches giant lecture halls with a couple hundred students in them, in spite of asking, he's still at about 5% wearing a mask. And these are science students. These are students who are going into medicine of some sort.
I brought this up with Ashlynd yesterday, and I think I tweeted something, kind of like this, was that I honestly wonder how much of it is like I'm walking into a place, what's the cool thing to do? Sort of like if you went into a fancy dinner and didn't know how to use all your silverware or something. So you're
like you're watching everybody to see what that fork's for.
You're trying to see what the group think is. In Ashlynd, I brought you in because you said, I might be the same way. And I kind of think that too. I kind of think when I was in college, I'm not sure I wouldn't have acted differently. I want to think that.
Yeah, I did that in the beginning of the pandemic at the gym. I was like, no one's wearing a mask. Even though I want to wear one, I'm not going to be the only one wearing a mask. But now my thinking has kind of shifted because, like, now I want to protect myself and others. So,
well, and I kind of like, you want to think you're going to be the rebel. You're going to be the first person in the class, to stand out and do something. But it doesn't always work that way.
It's hard to be the first one to walk up there and take the mask and go, yes. I will protect your child. It is tough to be that first one. I mean, it's the same reason people don't call out, somebody when they're in a group and somebody makes a comment or a joke that's kind of racist. They just go, and walk away. It's tough to stand up, that kind of group think or that peer pressure. Even if you're just internalizing it is a really tough thing for people to study. I mean, that's why people study sociology, right? We know that people act differently in groups than they do as individuals. And maybe that's why, again, some of those bigger classes, it's harder to get the response than it is in the smaller classes where you're literally looking across the table like I'm looking at you right now, as opposed to someone being 100 feet away and part of a sea of humanity. Interesting, though. You think, I mean, here's an instructor saying, hey, these are all science students. We're trying to learn things like this, and this would be a practical application. But you also dug into something else last week, and that was nursing homes, long-term care facilities.
And in Oklahoma, statewide, the ones who at least reported to Medicaid and Medicare services. Under 50% statewide?
I believe so.
Staff vaccination rates?
No, let's see. I'm thinking it was, or was it in the 60s? I would almost have to look at that, or statewide. Yeah, I think I'm thinking nationwide. It was like 60-some%. I believe
we're definitely on the low end of.
Oh yeah.
However that is.
Right, but I think statewide, I want to say it was under 50%. And the thing is, when I looked at individual facilities, there are some that are doing pretty well. I mean, even here in Stillwater, there was, one I looked at where I think the staff, more than 80%, I want to say like 87%, 89% of the staff is vaccinated. But then there's another one just, less than a mile away where the staff is 30-some% vaccinated, sub 40%. And the thing is, the residents overall are pretty well vaccinated.
Right.
You're in the high 80s to the 90s across the board, just about, in terms of residents of long-term care facilities. Now, the problem is these folks aren't that mobile. They're not going anywhere. As long as they stayed there in that environment, they would be okay. But you have a staff that is mobile, that leaves at the end of the day and goes and does whatever. And I may be overgeneralizing, but I don't think so, that if you've not gotten vaccinated at this point, chances are you're not taking a lot of precautions just in general when you're out and about. Like maybe you just don't take it that seriously, is what I'm assuming anyway. So I'm just thinking that people who are not vaccinated at this point might be more likely to bring danger into these facilities with these medically vulnerable people. And that's what concerns me.
Well, it would probably be worth actually looking at the, patient interactions there. Because if you're not vaccinated, I would think that home definitely would have to have some other kind of barrier, because you'd have to know that even like if you're dealing with people who are in their late 80s, early 90s, a breakthrough case can also kill them.
Absolutely.
It's different. It's just different at that age level.
Well, one of the facilities that I spoke to has an ongoing testing program, and for any staff that is unvaccinated, they're testing them, I believe, twice a week. So, I mean, they are monitoring them very closely. So you can make the decision to not be vaccinated, but they're going to monitor your condition. And but that was the one where more of the staff is vaccinated, right, to be honest. I don't know what's in place at the one that has a very low vaccination rate.
Different levels of care. Ashlynd, you've been in a few of these places. You know what it was like when they were taking pandemic precautions. Have the precautions changed? Do you know? I mean, are they doing things
I think a lot of places are still closed to visitors again.
Yeah.
But the thing that's kind of striking me is like, okay, so they're closed to visitors because of the pandemic, but staff are not required to get vaccinated. So basically they can't see their family, but yet staff can come in unvaccinated. Like that's what's just. Yeah,
at this point you would have to think a really conscientious family member is probably better protected than someone in that industry who's
and that was the main thing,
precautions.
was that residents in those facilities need to see their family. They need that stimulation. They need to talk. And if they're not getting it, I don't think that's fair that they're closing to visitors, but staff don't have to be vaccinated.
That's a good point.
Well, and now the federal government is trying to do something about that, isn't it? I mean, the whole idea is that this is how the federal government can get things done, because it can't necessarily require a state to do things. It can't necessarily require an industry or private organization to do things. What it can do is it can withhold federal funding. It can apply conditions. I mean, we've talked about this before. This is how the 55 mile per hour speed limit got adopted in a lot of states. The federal government said, if you want all your federal highway funding, you're going to look at this and you're going to do this, because not everybody was a fan of that. This is kind of the same thing. The federal government is saying that your reimbursement through the Center for Medicaid and Medicare Services, which is what long-term care facilities and hospitals really, really rely on, that it could be cut if you don't require your staff to be vaccinated. So now these facilities are having to, kind of weigh and measure, right? How much does this affect our bottom line? How much of a staffing problem are we going to have? How do we do all this? And of course, there are the discussions about federal overreach and violations of civil liberties and all kinds of things going on. So it's really stirred up quite the proverbial hornet's nest.
Well, and this is where I come back to things like vaccine passports, which is our sort of shorthand for requirements for entry, is that you be COVID-19 vaccinated. And honestly, doesn't it seem at this point like there should be some places that can do that without any qualms? I don't, especially if you're talking about a nursing home. But I think I shared something with Ashlynd that was like, what was it about the states with the highest levels of fake? What was that? I can't think of.
I remember that.
Those ranking sites. We get a lot of those
vaccine cards. And Oklahoma was like ranked up there.
We're top 5.
Yeah.
Finally in the top 10. Yeah, I think we were top 5 for residents most likely to
get a fake vaccine card.
A fake vaccine card.
Well, wasn't there a bust just last week? There was a news story about that where someone was busted with like thousands and thousands of fake vaccine cards.
What's the law they broke there? I'm curious.
I don't know. That's a great question. I don't know.
I mean, I think it would probably be something along the lines of a fake ID.
I don't know.
Is it a forged government document?
Yes, I would think.
Falsified government document?
Could be.
Yeah. Okay. Uttering forged something.
Yeah, I mean, maybe that vaccine card is considered to be a government document since it's issued by your state health department.
It could be. Falsifying information.
Yeah.
Stuff like that. Which I think those are just misdemeanors.
I'm okay when we come on here and don't have the answer for everything.
Yeah. Maybe somebody else knows. I don't know. We just want to start a conversation, man.
It'd be interesting to find out, though.
It would be.
It would be.
Maybe people will start Googling as soon as they hear this. But yeah, I mean, it is. Okay, but here's the thing. Private businesses are already exercising the right to require proof of vaccination. Medela Art Gallery, for its music events, for its various events, has now established a policy that you must show proof of vaccination to enter. I believe there are some concerts maybe going on at the Cain's Ballroom.
Wild that it's the artsy folks who are the first on the scene doing this.
Right? I mean, I'm just saying that if these organizations can do it, I think anyone could do it. And my thing is, at the nursing home, as Ashlynd was saying, I mean, that really does make a great point. If you, especially at a place that has like a 37% staff vaccination rate, I don't see how they can justify keeping vaccinated family members away from their patients or their residents. I honestly don't. It seems like that would be tough to defend. I don't know. So, I mean, it's tough, right? There are a lot of challenges with the final FDA approval of the Pfizer vaccine. It is now fully approved for people 16 and up. 12 to 15 is still under investigation in terms of final approval. They've not, that's still under emergency use authorization. You would hope that there would be this wave of people going and getting vaccinated, that anyone who was kind of on the fence, they just felt like it hadn't been through the whole process, they weren't comfortable, doing it under emergency authorization, that, now they would say, okay, this is what I was waiting for. It'll be interesting to see, right?
Have they done the trials for like children under 10?
They're working on it now.
Okay, so now we're almost in the we had the I think they follow about 5 to 6 months after the trial period, right, where they actually open it up. So
they're in trials on kids 5 to 11.
Okay.
Yeah.
So I may have found an answer to the fake vaccination cards.
Okay.
It says, additionally, the unauthorized use of an official government agency's seals such as HHS or the Centers for Disease Control and Prevention is a crime and may be punishable under Title 18 United States Code Section 1017 and other applicable laws from FBI.
Federal crime.
Okay.
Yep.
Okay.
Well, that makes it a little more serious, too.
Yeah, I know.
At that point, you've committed a felony, right? That's jail time.
Federal jail time.
Yeah. Okay. Yeah. I mean, so there's just so much going on. You're right. I mean, we kind of felt like things were dying down and everything was good. And we're like, hey, we got a movie with our name on it and this is cool. And now all of a sudden it's like, oh, crap. We're back in a pandemic.
And things are still weird.
And things are still so very weird.
You think you'll talk to one of our veterinarians about
yes,
about dewormer?
Yes. That is absolutely on my list for this week. I also want to see if I can find any stats from poison control about, are they getting calls? Because you're starting to see those stories about how the calls to poison control are ratcheting up. And I know I've said this before on the podcast and in the newsroom. My daughter worked for a vet for a while, and they last year were limiting who they would sell ivermectin to, because they were only selling it to established clients who they trusted. Basically, if some rando came in and said, hey, I want to come in and buy a big bottle of your finest cattle dewormer, they wouldn't sell it to them, because people were already doing this. We had talked about this way into last year, that this was a thing that people were trying. And now all of a sudden it's just like popped up and it's in every news story.
Well, there was a big sort of like video titled "Your Government is Lying to You" or something like that I've noticed everywhere, and it's someone claiming to be an ICU nurse who starts off saying, go watch the Joe Rogan podcast and you all should be taking like this drug or something. So I think, it's been viewed, I don't know how many millions of times. So I think that was like the latest sort of explosion for that.
I just, I always wonder, the question you have to ask when you see this stuff is, who profits from this?
I don't know.
I mean, who benefits?
My question is, who gets their medical advice from Instagram or Facebook? That's my question.
A lot of people.
An alarming number of people, I'm going to say.
Yeah.
I don't know. I mean, is Big Dewormer behind this? I don't know. No, I don't think it actually is. I mean, I'm sure that the companies that make this are probably kind of horrified and just waiting for someone to poison themselves and die, and for them to get sued, and they are probably shaking in their boots right now. It's just crazy though. I mean, and I will say that you used to be able to go to the veterinary section at any local farm store and buy things that are kind of eyebrow raising. I mean, it could be, stuff that if it was misused could not be good. Definitely. So, I mean, ivermectin, just don't do it. I mean, the whole principle behind worming, a cow or a horse. By the way, these animals weigh over 1,000 pounds. So, I mean, using medicine that is formulated for them, not the greatest idea, especially if you're not really good at calculating dosages and you don't know how to do all that. That's probably pretty questionable. The other thing is the principle behind worming, as I've started to say, is that you're basically giving your animal enough poison to kill whatever parasites are in their system without killing the animal. That's what you're doing to yourself when you're taking ivermectin. You are ingesting poison.
Well, just that known, then how could that be prophylactic?
It shouldn't be.
I don't know. That's weird to me.
I have so many questions about the people that are doing this. So many questions. So if you're doing this, hit us up.
And we will tell you to stop.
I need answers on why someone would ingest poison just willingly.
Right? I mean, I think Instagram and,
I feel
YouTube
like it would burn.
Oh, you would
so
have
much pain.
You would have such a stomach ache. I mean, seriously, like if you read the labels on that stuff, if you give your dog too much wormer, your dog will start to, I mean, it's like an insecticide. Your dog will start to drool. It will start to shake. It will have tremors. I mean, it's like, it would be so easy for someone to make themselves really, really ill with this stuff. It's kind of terrifying.
Yeah. Whoa.
Anyway, not kind of. It's just flat out terrifying. I'm going to take away my qualifier. There's no qualifier for that. It's scary.
Ashlynd, what are you working on? Just court stuff.
Yeah, just court stuff.
Okay.
Nothing interesting.
You're just hoping I wouldn't ask.
Yeah,
Right.
I honestly did not think you're going to ask me today.
No, I mean, she has a big project that she's working on. She doesn't want to unveil it, too soon.
We'll tease to that.
But
few
just
weeks,
know
we'll
there's
talk a
something
little-
big coming.
Something's
We
coming
got 4
on the
weeks
horizon.
out.
Okay.
So.
Yeah, but she's hard at work, feverishly. She's working feverishly on this.
Okay.
Yes, and then we've got some stuff going on in the city. We've got a couple meetings this week. Of course, it will be over by the time people hear this probably, but we're looking at a lot of infrastructure stuff, a lot of big money projects, a lot of big expensive things that could fundamentally change the face of our city, really. There have been at least 4 areas for spending that have been identified by the City of Stillwater. And these are things that have come also from discussions with residents over the years. The need for a new animal welfare facility, the need for a new fire station, and I can't remember what the other one is. And then there is a lot of transportation projects, just a lot of road stuff. And tonight I'll be going to a meeting, one of the first meetings. They're going to be going to every quadrant of the city to hold a meeting and get resident input on these projects. Our working theory, and I think it is correct, is that it's the city's way of doing some public education and building some support for the idea of, a potential bond issue or something along those lines to pay for some of these really expensive projects, because there's no way that we can do them on a pay-as-you-go basis. And then tomorrow night, there's going to be a 6th Avenue, State Highway 51 corridor meeting. And basically, the Oklahoma Department of Transportation is going to come through. It's going to be rebuilding basically Highway 51 that passes through Stillwater is 6th Avenue. And that's going to have a big impact on all the homes, all the businesses that are all the way along that corridor. So this is people's opportunity to think about what that's going to look like, what we're going to do. It's important not just in terms of moving people from east to west and west to east in Stillwater. It impacts a lot of neighborhoods. There's a school that has a crosswalk that crosses this road.
Sure,
faces that.
A lot of front-facing business.
Oh, yeah, a lot of front-facing business. You've got the hospital. And then you have a lot of students who attend Oklahoma State University who live south of 6th Avenue now, and who cross that street on foot, on bicycle, every day, multiple times a day to get to campus. not only that, but on game days, you have people parking, south of 9th Avenue now and walking up to the stadium.
Sure.
So, I mean, you've got a lot of foot traffic. There's just a lot going on there. So we have to look at not only the roadway itself, but how it impacts the people and the businesses along the roadway. And then how do we get people across that roadway safely?
Right.
So there's a lot going on with it.
Giant underground tunnels.
Oh, yeah. Or like those wildlife bridges, something like that I think would be cool.
But they are still kind of in the idea phase, though, right?
They are.
Like just about anyone could pitch just about anything, or have they?
I think there was an initial ODOT plan that is going to be tweaked. That's
okay.
I mean, I think probably ODOT had a general idea of doing what transportation agencies do, was building a nice wide road with extra turn lanes, and that's going to move automobile traffic very efficiently. I think that was probably already something that was in development, and the people in the town who actually have to live around this and get across it are going to have to say, hey, wait a minute, let's think about this. So I think it can be tweaked. I think there can be other things added to it. But I do think that was already kind of in the works. So, that's why it's important for people to get involved in this. If you live along here or you have something to do with 6th Avenue, come out and check one of these out, because it's going to change your city. It's going to change how you live and how you get around.
It's kind of big idea time again.
Exactly.
Like we've gotten back into that.
Yeah.
I think since the last time we've done the city did the what was it? Raffle. What do they call
the
it?
vaccine incentive.
Yeah, the
drawing.
The incentive campaign, and they've already had how many? Few dozen people within the first couple of days.
I actually have not gotten the numbers yet.
Okay.
I'm going to call them and get those numbers though, because it's the opportunity.
Probably a lot more now. I mean, I'm talking about what I heard after the first couple of days.
I'm sure it was. It's probably been quite a few, because I mean, basically, if you are vaccinated or you've gotten your first shot of your vaccine series, you can go in and register to win $25,000 cash prizes, or there are some OSU football tickets, like club level football tickets that are being given away. You have to provide proof of residency. So you have to, like a utility bill, a lease, something like that, a piece of mail that came to you at your address, your vaccine card, preferably not a fake one, and your photo ID to prove that you are that person on those two documents. And if you do that, then they're taking entries through September 30th. And then on October 1st, they're going to do a drawing.
Okay.
So 20 people could win $5,000 just for being vaccinated. And again, there's the hope that this is going to take those people who are kind of on the fence and give them a reason to go ahead and do it. A lot of places are trying this. The federal government flat out said that this is an okay use for federal, like CARES Act funding for federal relief funds, which, doesn't sit well with everybody, but it
also made me think, how much of that stuff is still just out there?
Right?
How much do, different cities still have that they're trying to figure out what they can do with it?
Well, there's a lot of federal money flowing right now. And, you don't want to not use it, right? I mean, the City of Stillwater is directing $50,000 of this relief funding. And then Stillwater Medical Center is providing another $50,000. That's how strongly the local healthcare officials feel about encouraging people to get vaccinated, because they're tired, man. They're tired, and they just need some relief. They want to get this done.
In this way, it can also kind of serve as a stimulus. If you're giving $5,000 to 20 different people out here in the city, they might put that right back into the city, buying with whatever purchases they make. So
absolutely, it's a little bit of a win-win. Or if you're helping someone who's having a hard time. People who've lost income during the pandemic. I mean, $5,000 could be a great financial shot in the arm for somebody who's just kind of getting by. Okay. So people need to get out and do that if they haven't already. And the thing is, it doesn't have to be a new vaccination. If you got vaccinated, last February, you can still register. So they want to make it really fair. Anyone who has a Stillwater address, basically, who has been vaccinated or who has gotten at least their first shot, Now, you have to finish your series before you can collect your prize, though. So if you just go out and get your first shot today and you register tomorrow, you can't collect your prize until you show proof that you've gotten your second one, basically.
Okay.
They'll hold them through, I think, November 5th, they said, which is enough time to let everyone complete their series.
All right.
Yeah. But anyway, it's all COVID all the time right now.
Yeah, for now. Yeah. We'll see. We'll see how it goes. Yeah. Things are getting weird again.
They are.
But that'll probably do it for us. We'll come back next week with something probably equally as weird.
Probably.
Okay.
I'll know more about how we're going to spend all that money. Maybe.
All right. Thank you for joining us in the newsroom. Thank you for joining us in the newsroom. Look for Studio Stillwater wherever you find your podcasts. Find archived episodes on stwnewspress.com.